Hey guys, in this video we will discuss, are you at risk for developing esophageal cancer? For those guys who are joining me today, my name is Dr. Samir Islam. I am a board certified gastroenterologist practicing in Lubbock, Texas, and my passion is to give you accurate information that's based on research for your GI tract and for your GI health. If you like this video, I'd encourage you to like this YouTube page. You can certainly like my Facebook page as well, and subscribe to my newsletter where I give various tips throughout the day and throughout the months about some of the things that you can do for your for some of your GI issues. But in today's talk, you will learn if you're at risk for esophageal cancer. Are you one of those patients who may be at high risk of developing this cancer? Are you at risk for developing cancers within your GI tract as well? Or is there something else going on that can be affected by that? And my job today is to give you that information. And so this is all part of what's called GERD Awareness Week, which is coming up pretty soon. Around the holidays, we have a lot of people who enjoy the holidays, whether it's having Thanksgiving dinner, Christmas dinner, going out with friends, not eating the things that you normally do, which can make you more likely to have reflux symptoms. And so part of that is a discussion about GERD Awareness Week, and this is part of that talk with respect to that. So when it comes to esophageal cancer, there are two main types of cancer. There's adenocarcinoma and there's squamous cell carcinoma. These are two types of cancer within the esophagus. They have different risk factors that can lead you to develop these particular cancers. Adenocarcinoma is going to be the one that I'm going to talk about because that's the one that's really typically associated with chronic acid reflux. And that's the one that most people get who have a history of chronic acid reflux or heartburn. If they have a risk for developing cancer, it's adenocarcinoma. That's the type of cancer that they may have. Now, adenocarcinoma, the biggest risk factor is chronic acid reflux or heartburn. This is a very common trigger for that. What happens is that acid causes damage inside that esophagus, which eventually that damage becomes more and more severe, leading to cancer. And about 10 to 15% of patients who have chronic acid reflux or heartburn will develop cancer. So in the vast majority of people who have acid reflux, it will not lead to cancer, but there is that small percentage when it can. It's hard to differentiate between which patients are the ones that are going to progress into cancer and which ones don't. It's hard sometimes for us to know as doctors to know which patient that we need to keep an eye out for. We do know for a fact that those patients who have a higher risk of developing cancer are those that have chronic acid reflux. And this is due to a precancerous condition in the esophagus called Barrett's esophagus. This is a lesion inside the esophagus that occurs when you have chronic acid reflux. You have all this damage that occurs into the intestinal lining of the esophagus, and that chronic damage can cause inflammation to occur. That inflammation will produce precancerous cells, and eventually over time, if acid reflux is left untreated, those precancerous cells can progress into esophageal adenocarcinoma, and that Barrett's esophagus is that precancerous lesion inside the esophagus. Now, not everyone who has Barrett's esophagus will have esophageal cancer, but that does put you at a much higher risk of developing this particular problem. And like I mentioned before, the reason you get Barrett's esophagus is because you have chronic acid reflux causing damage inside that esophagus, which actually changes the lining of the mucosa of that esophagus, and that changing of the lining can get worse and worse and worse, eventually leading to the progression into esophageal adenocarcinoma or esophageal cancer. Now, the difficult thing, like I mentioned before, is that we can't really know which patients are at risk for developing cancer inside the esophagus. We used to think that maybe the more frequent patients have had acid reflux, or the severity of symptoms could correlate at least to the risk of developing esophageal cancer. And unfortunately, it's not the case. Most people who have esophageal cancer will tell you they may have intermittent reflux, they may not have it for a long time, they try taking acid-reducing medications seem to help, and it's not a frequent symptom. And those people who have a lot of acid reflux symptoms or a lot of heartburn or a lot of regurgitation, they actually may not have anything inside the esophagus at all. So it's very difficult for us as doctors to know which patients are at high risk of developing esophageal cancer or esophageal adenocarcinoma, especially considering that the severity of symptoms and the frequency of symptoms don't really correlate at all. Now, in summary, those patients who have chronic acid reflux or chronic heartburn are at risk for developing esophageal cancer. This is one of the primary risk factors for developing that. And what happens is that you develop this precancerous lesion inside the esophagus that can eventually go into esophageal cancer. And so our goal, obviously, to help prevent somebody from developing esophageal cancer is to see if we can stop that chronic acid reflux by a lot of different ways, which I'll talk about in the next couple of videos. I want to thank you guys for joining me today. Every 7:30 p.m. on Tuesday, I do a Facebook Live on various topics. If you want to hear about more topics that I've talked about, I would encourage you to go to my YouTube page where I post all my videos after I speak on my Facebook Live. If you like this video or like my other social media, I would encourage you to follow me on my Facebook page, follow me on Instagram, and even on YouTube, where I post all my videos as well. I want to thank you guys for joining me today and look forward to seeing you guys next week as we will continue our series on GERD Awareness Week about other things we can do and other topics about heartburn and reflux. But I hope you guys have a great day. Thanks and take care.